Okay, so you've chosen your suture. Now, what else are you going to need in order to close a simple skin wound? First, local anaesthetic. If your patient is awake, check their allergies, check their past medical history, but generally, you're going to want some 1% lidocaine. A lot of trusts have suture packs, and these contain generally all the kit you'll need. They'll contain a few pots and swabs and things, but also they'll contain a needle holder, some forceps, often toothed and or non-toothed, and some suture scissors. Let's go through these tools one by one briefly. The needle holder. So, a needle holder is designed to be used in your dominant hand. I would suggest holding it with your thumb through one arm, and then your ring finger in the other. This will allow you to use the ratchet system, which opens and closes with a small push and twist movement. That can take a bit of practicing. Sometimes you'll see people palm the instrument to allow more dexterity. I'd really avoid this when you're starting out. As well as practicing the ratchet, it's important to practice moving the needle holder. So it's all about pronation and supination and elbow movement, and this allows you to push the needle through the skin along its curvature, rather than just forcing it through. This is quite harsh to the tissues if you do it wrong, and you can damage them. And also, you'll just deform your needle, making everything just really difficult. Forceps. The tooth ones, they give you a better grip, but are a bit harsher on the tissues, so be careful with how harshly you grab things with these, as you can puncture and bruise even the toughest skin. Your forceps, they should be held in your non-dominant hand, and should be held like a pen. This will give you your maximum control. Suture scissors. These are often the first instrument you're given as a medical student or foundation doctor in theatre. Now, it's great if you're using a brand new set of disposable scissors. However, be mindful that some of the suture scissors in circulation, they've had a hard life and may be fairly blunt. In order to maximise your cutting ability and impress your bosses, practice pushing the tips of the scissors together by applying a push-pull pressure with your thumb and finger, and cut with the tips of the scissors. This will make even the wonkiest of scissors do the job. Remember that most scissors in circulation these days are designed to be used with your right hand, and that's just due to the way the blades are orientated. Unfortunately, any left-handed folk out there will likely have to become adept with right-handed scissor use. There are ways to use your left hand to maximum effect when using scissors, but I'd suggest asking your bosses to show you that. Okay, so we have all the equipment we need, our wound is clean and numb, and we're ready to stitch. So let's go through the steps to perform a simple interrupted suture. First, you'll need to get your needle out of its packet. Grab the body of the needle about 2/3 of the way along from its tip, and make sure you're using the tip of the needle holders. Ratchet it. Yeah, that's a really hard word to say. Ratchet it. Ratchet it into place and disengage the needle from its packet. Carefully unravel the suture material, making sure to keep it clean and out of harm's way. Let's suture. Step 1. Starting on the side that's furthest away from you, gently lift the skin with your forceps without grasping it too tightly, and place your needle tip about 0.5 centimeters away from the edge of the wound. You should aim to enter the skin perpendicular to it, so that's 90 degrees straight up and down. You'll need to maneuver your wrist and elbow to get into this position. Pierce the skin and then follow the line of the needle into the wound by supinating your forearm. Aim to come out in the middle of the wound. Step 2. Unclip your needle holder ratchet and grasp your needle with the forceps before releasing your needle holder completely, and pass the needle from one hand to the other in order to advance it completely through that side of the wound. Pull your suture through, leaving around 3 to 5 centimeters for you to tie your knot. This will vary as you gain experience in different knot types though. You're now ready to approach the second side of the wound. Step 3. From this side, you're going to want to mirror the manoeuvre you've just done, lifting the other skin edge and going from the middle of the wound to the skin surface, aiming to again have 0.5 centimeters between the wound and your exit point. It should be equal to the other side so that you match the skin tension and create an even scar. Again, pass your needle from one hand to the other and pull your suture through. Make sure you don't pull so hard that you pull your end through, because you'll just have to start again. Step 4. Knot tying. Now, the key phrase to have in your head when you're first starting is needle holder in the middle. Let me show you what I mean. Place your needle holder over the wound longitudinally, in line with your entry and exit points, but perpendicular to the path your suture has travelled thus far. See, it's in the middle. In your non-dominant hand, hold the long end of the suture with the needle on it and loop it around the teeth of your needle holder twice, in the direction looping away from yourself. From here, grab the short end of the suture and pull it across the wound, pulling the needle holder towards yourself whilst you pull the long end of the suture away from yourself. That's in the opposite direction. This will lay down the first knot in a nice, tidy, flat way. Depending on the type of suture you're using, if you release the tension on this first knot without doing anything, it may loosen. If so, you may have to lock the knot by pulling backwards with your long end, as I've done here. If you're using a braided suture, this is less of an issue. Now you're ready for your second throw. Again, put the needle holder in the middle and loop the long end of the suture around the teeth of the needle holder in the direction looping towards yourself. That's the opposite of the direction you used for your first throw. Then, grab the short end and pull it away from yourself, whilst pulling the long end towards you. This should create a nice flat second throw of your knot. Try and pull the knot to the side of the wound rather than the centre, so it doesn't get enveloped in the healing wound and cause issues on removal. The patient won't like that. Repeat this alternately. So next is the same direction as your first throw, but you only need to loop once for every throw except that first one. Most people will do 3 throws as standard, but some sutures do need more if they're likely to unravel, so if you're unsure, put a couple of extra throws on. That's your knot hopefully tied, and you're ready to cut your ends. They need to be long enough that the knot doesn't come undone and they're easy enough to remove, but not so long that they're untidy and interfere with your other knots. About 0.5 to 1 centimeter is about right for most skin sutures. On to the next one. Try and make each suture about 0.5 to 1 centimeter apart along the length of your wound, and work sequentially. Make sure you're matching up your 2 edges nicely, otherwise you'll end up with a dog ear type end at the edge. And make sure your depth and width of bites is all even, as otherwise it'll affect the cosmesis of your scar. And that's it. Simple interrupted suturing is the bread and butter workhorse for most non-surgeons, although ironically it's not used all that much in actual surgery. If you can master this, then you're well on your way. Make sure you specify when the wound needs reviewing in your documentation, including when those sutures you've put in should be coming out. Ask your senior to clarify this, as it depends on which part of the body is in question. Dispose of your sharps safely, and make sure you perform all hand hygiene, and wear appropriate PPE throughout all of this. And that's that. As always, don't forget to like and subscribe so you never miss a thing.